Welcome to Careteam. We are focused on improving care coordination across healthcare, including chronic disease management, particularly multiple complex chronic conditions, discharge and other transitions, surgical preparation and recovery, and wellness and health management to solve the fragmentation we all too often experience in healthcare and help people to stay healthy. There have been many initiatives in healthcare to move from paper to electronic records and enable the sharing of medical records between facilities and providing patients with access to their personal health record. But we find that what patients and families ultimately want is to know what the plan of care is, the resources available to help them, and help them to manage the real-life realities as things change. Healthcare teams simply want the ability to collaborate, to plan the care, to track progress, and to communicate amongst themselves across different organizations. Careteam is the bridge across healthcare and between healthcare and home. We looked across healthcare, and whether you look at chronic disease management, discharge, or other cases, care coordination always comes down to the same 5 key things. Knowing who is involved in the person's care, knowing the plan, knowing who will look after each item in the plan, being sure that those things are happening, and having a mechanism to communicate amongst the team. We built Careteam to support both the healthcare team and the patient and support team. Underlying Careteam are 5 key functions: identifying who is on the care team, providing the care plan, translating that care plan into appointments and tasks that the family can manage, and a mechanism for secure communication. Careteam also integrates to third-party platforms for things such as video telehealth consultations and chronic disease management applications. As we go into the demonstration, we will focus on 3 main functions of Careteam. First is wrapping the healthcare team around the patient, supporting shared care and multidisciplinary team-based care models. Second, engaging the patient and family in helping to manage the person's health. And third, tracking progress and following up proactively. Careteam can be accessed from any device with a modern web browser. Seen here is the same view provided on a desktop view and a mobile phone view. Careteam supports collaboration around a person's care plan in 2 related ways. First is a collaborative or complex care plan, which allows multidisciplinary teams to support the patient in managing multiple chronic conditions. The second is an integrated view, which brings together care plans from any aspect of the healthcare system into a single integrated and dynamic view. In the first case, a multidisciplinary care team shares a single collaborative or coordinated care plan and manage multiple conditions from within that same care plan. In the second case, Careteam recognizes that people may have care plans in multiple different aspects of the healthcare system: an emergency department, a physician office, or community care. A user has a single login, and what they have access to is designated by the patient. In this case, patient Hannah has a dementia care plan, as well as a follow-up care plan, and has an overview which shows all of her tasks in one view, including from the dementia care plan and the fall follow-ups care plan. First, we will log in as Hannah and access the care plan that was created for her by her clinician. The care plan starts with personal care instructions, typically verbal type instructions that would be provided to the patient or their caregiver. Patient goals are a place for the patient to designate what they are hoping to achieve. Documents is an opportunity to share documents that can be accessed by the patient and their caregivers regardless of location. And the task list becomes the heart of Careteam, which records the prescriptions that need to be filled, the appointments that need to be booked or are upcoming, and the other tasks that need to be completed. They all come together in this one integrated view on the tasks page, so everybody can see what's outstanding and who's looking after each task. The family can add tasks and add appointments to keep the care plan up to date. Here, daughter Janet is being removed, and instead the task is being assigned to granddaughter Alexis, who is available to take it on. Alexis will get a notification asking her, and she can log in and confirm that she will do it. In the task list, we see that Alexis has been assigned, and we're waiting to hear back from her. The next important form of task coordination is the activity feed, which acts like a Facebook or social media interface. Anyone in the family team can post an update at the top, letting them know what's going on, and every task or appointment or document that's created in Careteam shows up in chronological order, and family members can comment on them, letting them know how things are going, offering to give a person a ride, or offering them to help out with something. The third main form of coordination is secure messaging, which allows each individual user, both clinicians, patient, and family members, to communicate directly amongst one another, as well as allowing the patient and family team to communicate with the clinic to coordinate upcoming appointments. Users always receive in-application notifications, but can also go to their profile and choose whether they also wish to receive the notifications via email and/or via text message. In their profile, they can also change their language. Careteam is currently translated into both English and French. On the team page, healthcare providers can confirm that the person has a support team in place at home, divided up into the circle of care, starting with primary caregivers, the support team contacts, other support team members, caregivers, and extended team members. Each level of the circle of care has a different level of access to the person's care plan and personal information. Next, the patient and their family can see what team members are involved from the healthcare team, their role, and contact them. Finally, Careteam preloads the platform with resources available in the local community, and when creating the care plan, the healthcare provider identifies which ones are relevant to this person. The health information page is a place for the patient and primary caregiver to record key pieces of information which they feel may be relevant to other members of the care team. Healthcare providers have a single login regardless of how many places they work at. Once they log in, they're presented with their professional profiles and they select the place that they are at. Their access privileges are then set accordingly. The healthcare provider is then presented with a patient list from which they can search or select the relevant patient. The healthcare provider can then see the care plans for which the patient has granted them access, in this case the person's ongoing dementia care plan and an emergency falls follow-up care plan. They can view the care plan, the patient information page, the audit log, and the person's team. There are two ways to create a care plan. First is to create a full care plan. The healthcare provider starts by entering the person's demographics to register the person. This can be done manually with this screen, or the information can be brought across from the electronic medical record. Once the person is created, additional address and phone number information can be entered, as well as the family physician. A care plan title is provided, which identifies the care plan. There are optional fields for the registration or admission date and the discharge date. A diagnosis can be entered, and then personal care instructions can be entered, either for the patient or information that's relevant for the caregivers. Then the heart of the care plan, the tasks, which are made up of prescriptions, appointments, or other tasks. The healthcare provider can enter an appointment which they want the patient or the caregiver to book and leave it as selected patient needs to book appointment, or they can uncheck that and enter an actual date, time, location, and other details. Other tasks are for any other kind of task that the patient or family need to look after. Lastly, Careteam will have preloaded all resources relevant in the community to this particular clinic or organization, and the healthcare provider can simply select the ones that are relevant to this patient. The clinician can then attach documents in the form of handouts, guides, caregiver guides. Document is attached and then provided a title and saved to the care plan. The final step is inviting the patient and their caregiver team. First, the patient is invited to the care plan. In some cases, the patient themselves will not be the primary user of the care plan, or they may use it in conjunction with a primary caregiver. There's a consent statement for the care provider to confirm that they have received the patient's consent or that the caregiver has power of attorney. And the final step is to activate the care plan, at which point the patient and caregivers receive invitations to join the care plan. Finally, in cases where the healthcare provider does not have an opportunity to provide a full customized care plan, they can use the predefined care plans. They simply enter the person's email address and choose from a drop-down box to choose the standard care plan template, and then they send a link, and the person receives an invitation and a flow to sign up for Careteam with predefined instructions, tasks, resources, and documents relevant to that particular condition or care plan. From everyone here at Careteam, thank you very much for your time, and we very much look forward to working with you. Please feel free to contact us at any time at support@careteam.me. Thank you very much.